All right, I think we might be ready. Good afternoon, everyone, and thank you all so much for being here for today's Developmental Screening Summer webinar series session, The Keys to Unlocking Electronic Health Records Integration for Developmental Screening Tools. Today we have Mr. Brian Richmond here representing the Louisiana Healthcare Quality Forum, who will present today's session. Before we begin, I just wanted to read a quick disclosure statement. Please be advised that the speaker for this session has disclosed that he has no relevant financial relationships. All remaining faculty, Louisiana AAP Education Committee members, and staff have no relevant financial relationships to disclose with ineligible companies whose primary business is producing, marketing, selling, reselling, distributing, or of healthcare products used by or on patients. All relevant financial relationships have been mitigated. Also, a quick note, if you are a social worker, nurse practitioner, or physician, and you would like to receive CE or CME credit for your attendance today, please make sure to attend the webinar in full and complete the evaluation at the conclusion of today's session. Also, for anybody, if y'all feel like you have any questions you would like to share, please feel free to type those into the Q&A section or the chat section, and we'll go over those at the end of the session. Okay, without further ado, take it away, Mr. Richmond.
Thank you very much. It's a pleasure being here today. My name is Brian Richmond. I'm the Chief Technology Officer at the Louisiana Healthcare Quality Forum. We're a nonprofit organization here in Louisiana that promotes interoperability and health outcomes through leveraging health information technology. Quick agenda today, our introductions. We'll talk about the high-level objectives for today, speak a little bit more about each of the objectives, and then wrap it up at the end with the question and answers. So today we're going to talk about how can we leverage these screening tools into the EHR to make them more effective in using them in care of our patients. The first core piece of that is to make sure the information is integrated into your EHR, train the staff so that the tools are being used as expected, and then follow up with that component. So we'll go over those different objectives as we move on through the presentation. So the first objective is facilitating the data integration. So what do we mean by that? So within electronic health record systems, there are different ways information can be captured. A lot of times when you go into the EHR, you see there's a tool, you open up an encounter, fill out the information, and save the information in the EHR. Just because the information is entered in through an electronic form doesn't mean it's necessarily saved that way. A lot of cases, the form is there just to make sure that all of the information gets collected, and if there are certain limitations on what the answers can be, that the correct answers are put in. So one of the key pieces you want to make sure is you understand within your EHR, if it has these tools, how's that information being stored? Is it being stored as the individual answers tied to the questions of the particular screening tool, or is it currently just being stored as what I call an electronic piece of paper? Then that gives you some information to go back to your EHR vendor. Some vendors have these modules already created into their EHR for these different screening tools, and they'll give you a quick answer of, yes, we can do that. The big question is making sure that we ask, how is that information being able to be used and accessed after it's initially filled out and added into the EHR? There's also companies that provide third-party tools that integrate into the electronic health record systems based on the standardized questionnaires, Or the third option is working with your EHR vendor to actually build the questionnaire tools into your EHR directly. The important component that is to understand what you're wanting to do, what you're going to be able to do with that information so that you can work with the EHR vendor to make sure, or your IT department, if it's an internal person, to make sure the system is configured to not just collect the information, but be able to leverage it and utilize it after it's been collected. Part of that goes into making sure also what information do you want to capture? Do you want to capture each individual question or response? Do you need to be able to just capture the score at the end of the questionnaire, depending on what your use case is within your practice? Then the other piece that's very important upfront is to understand that consistency is key, and making sure that everybody's on the same page with how the information is being collected, how the information is being stored within the EHR. I have here about standards such as USCDI, and I'm sure everybody's going, what is that? For the Health and Human Services, there's the Office of National Coordinator for Health Information that helps drive EHR adoption and integration standards throughout the country. This is that standard. This is the common data set for interoperability. What that says in layman's terms is if the EHR is able to store that information or present that information to the provider through that format, then it's easily shareable, not just within your practice, but if you need to refer to an outside agency, the information is in a format that external, that other provider or agency would be able to read within their electronic systems. So as we move on to enhance workflow awareness is the next objective. So one of the things is to be very document up front. What is your current process today? How is the screening tool being completed today? Is the patient or their guardian being handed the assessment tool while they're waiting in the waiting room? Is it while they're waiting in the office to see the provider? Is it an interactive session where the patient or their guardian is asking the question, responding to questions, and the information is being entered in by someone from the clinical staff? This helps identify early as you transition into electronic capture of that. How is that information going to get into the EHR? A lot of the electronic tools you see allow you, again, fill out the form electronically, but when you get to the end and save it, it becomes some type like a PDF document. So back to that electronic piece of paper. So we want to make sure that there's, if you're going to use an electronic tablet, do you have enough tablets? Is there the privacy needed in the waiting area to complete the tablet? If one breaks, do you have spares? So those different types of challenges and issues to take into consideration when you're looking at transitioning from filling out the assessment tool and scoring the questionnaire and to transition electronically is how's that information going to get into the system? And then what do you want to do with it when you're finished? Is that just going to come up in the EHR in a nice readable format? Do you want to be able to look at the individual responses to specific questions or specific sections of the questionnaire so that you can see what those responses are over time during each visit? It's important to make sure all those things are identified upfront within the workflow process, and think about those things. If there's someone that is not able to complete electronically, what's what's the other plan to do that? Is it to have someone from the clinical team facilitate that completion of the form, work through with the staff at the different interaction points within the encounter, those different touch points to potentially identify those different touch points, what the challenges may be, and identify those up front, and understand are there opportunities for efficiencies in workflow where the information is, once it's entered into the EHR, does that automatically flow to the next person into the encounter? Does it automatically calculate the response and make recommendations for care plans based on the score? There are organizations such as the Gravity Project that have examples out on that are available in the public community of how these tools are being how this information is being collected and not only used within specific care settings, but how that information is being shared amongst different providers and other agencies to meet the needs of our patients. The next objective is around promoting the effective use of the screening information. So it's real important to understand as you move forward with implementing these tools that everybody understands why the change in the workflow, what the benefit is to the care delivery and the long-term outcomes of the patient. Make sure that you have good training tools and processes, not just for the initial implementation, but also, as we all know, there's staff changes over time. And we want to make sure that as new people come on, they understand what's the proper protocols for entering the information into the EHR so that we're able to consistently capture that information and leverage it to affect outcomes for the patient. Along those lines, it's also important to even after the initial implementation and whether it's quarterly or every 6 months, just go back and look at how the information is being entered into the system. I know we all get busy at times where there's perhaps a clinic backlog where there's a lot of patients waiting to be seen, and everybody looks for shortcuts of how can I get to the end and deliver the service. That could affect the quality metrics down the road of wanting to look at particular values for whether it's a specific patient or a particular cohort of patients under your care. So that's one area that's real important, is that continuous training and evaluation. Again, it's important as you move forward with the implementation aspects of going from a paper process to an electronic process, to collaborate with everyone at each touch point along the line during the encounter so that they understand what the change is, why the change is being made, and address any potential challenges up front. There's always going to be challenges when you go live, but additional processing and testing up front does help minimize those challenges and those risks. The other thing is look at there's a lot of organizations out there throughout the country that are leveraging these tools in their care plans and their care coordination, and take opportunities to learn from others and how you can leverage that information, what their successes, what their challenges have been, to limit those in your practice area, and encourage everybody that it's real hard if you can't measure it to assess it and make improvements. So that's a key component in leveraging health information, is the information is only as good as the information that's put in the system. So, so again, to sum up, the facility, it's very important upfront to understand what your different options are with your particular EHR vendor of how that information can be entered into the system, whether that's a module that they have available within your EHR, and how is it configured to record and capture that information within inside the system. Are there opportunities, if that's not an option, are there opportunities to partner with third-party companies to integrate that information into the system? Or it may be more cost-effective option to build those tools into the system itself. Focusing on what your current workflow is today, how that workflow is going to get transitioned into an electronic process so you can leverage the value of the EHR and the information being captured. One example of that would be not that just that the questions and responses are being captured, but perhaps also developing flow charts where you can see those responses over time and see if there are any trends, whether that's for a particular patient or again within a particular cohort of patients under your care. And education is key in making sure that everyone involved in the process understands what's driving the change, how to make those improvements, and where there are challenges, get those addressed. How they can notify the appropriate people to get those challenges addressed. So, Teresa, are there questions?
Yes, there are. We have three questions so far for you. The first question is, do the forms such as the ASQ, PHQ need to be scanned in the system, EHR, once they are completed by the parent, if the provider has the information documented in their note from their form?
Well, that's a good question. If the information is just in the provider's, if the results are just in the provider's notes and they're just in the text, then that's not information that can be leveraged down the for future if we're looking at workflows and care coordination. If you're doing referrals to other providers or other agencies. So it's very important that the information gets entered into the system and captured electronically. I would look at your own record retention policies of if that information's been entered in electronically into the system, does it need to be retained as a hard copy in their medical record?
Okay. Our next question is there a recent update of all the forms that Louisiana Medicaid accepts?
Teresa, I think we'll have to get back. That would be a question for Medicaid, and we can see if we can find out what the answer to that is and get back with the group.
Okay, no problem. Let me just write that down. Okay. Next question. If we have a brief developmental screening tool or brief system in our EHR, is it possible to add fields to get an approved form, or do we need to create a new form from scratch?
I think that's going to be depending on your EHR vendor. Most EHRs have the ability to customize those modules to where you can add the additional information in that's needed. Or in some cases, it may be easier to start from scratch than try and modify. So I would bring those questions back to your EHR vendor and see what options they recommend being the most straightforward solution.
Thank you. Let me just check the chat to see if there are any other questions? One more. Okay. Oh, just asked, somebody asked to please send information about the forms over. Did you have a specific question about the form that Mr. Richmond might be able to answer? Okay, well, maybe she's typing that one. We have one other one. Can you please explain the process to initiate? Can you please explain the process to initiate speaking with our provider about our EHR concerns?
Uh, that's an interesting question. In most care settings that I've worked in, and whether that be in a hospital system or a physician practice, and again, whether that's a single provider or large provider organization, it's generally been a pretty open communication with the provider. It just, I would say, if it's relative to this specific scenario with these screening questionnaires and how the information is being put in the EHR, I could send you, after work with Teresa, some links to some documentation, some case studies that other organizations have used where they've implemented adding this information in electronically into and digitally into their EHRs, and how they leverage that to improve the care delivery for their patients. And you can bring that information to their attention, and that way they can make a more informed decision about next steps and how they address that within their practice.
That would be wonderful. I'm sorry, part B to the question or the
Yeah.
request that was, can you please send information about the forms? She just wanted to know what forms are accepted. I know the Denver form is not accepted, and somebody else said, where can we find these forms?
Okay. I guess I'm a little confused about where are the screening forms available electronically? We can send a list of that information to where those are available on the internet. As far as what forms, I think that also goes back to the question about what forms does Medicaid accept, and we can follow up on that as well.
For sure. So what I can do is for everybody on this call, there is a site that I can send out that will let everybody know which developmental screening tools are, if you're talking about reimbursable by Medicaid, where you can conduct the screener and then it goes in your EHR and all of that, and then it'll be accepted. I can send that over as well if that's what you're referring to. That's not a problem, in addition to the information about the case studies and how to kind of get everything started that Mr. Richmond will also send. Okay, and then so we have one more. Okay. Another person said links from the capacity checklist have been helpful finding screening tools accepted for us. Okay. Thank you so much. If there aren't any more questions or comments, I don't see any more here. I would like to thank you all so much for all of your comments and your questions. Truly, very much appreciated. And if you have any other questions for myself or for Mr. Richmond, I think he has the next slide might be your information. You can take down his information and email him at what's on the screen, and you can always email me. My email is going to pop up at the end of of the session today, along with the evaluation tool. And we will try to get all that information over to you all so that you can have everything you need to move forward, integrating those developmental screening tools into your EHR systems. Once again, thank you so much, Mr. Richmond, for coming and sharing this information with us. And I hope everybody has a wonderful day. And that concludes our webinar for today. Thank you so much.
Great. Thank you.
Thank you.